Hi, it's Dr. Steve Gabarty here again. On behalf of CMEO Outfitters, thank you for joining us for navigating the mycophenolate REMS, an interactive approach for the interdisciplinary care team. This activity is supported by an educational grant from the Mycophenolate REMS Group, a consortium of more than 25 companies working to communicate and mitigate the risk of embryo-fetal toxicity associated with the use of mycophenolate during pregnancy. This is the third of 3 CMEO snacks, and we'll review the mycophenolate pregnancy registry. Again, I'm Dr. Stephen Gabarty. I'm an abdominal organ transplant clinical specialist at Brigham and Women's Hospital and an assistant professor of medicine at Harvard Medical School, both in Boston, Massachusetts. I'm very pleased to be joined by Lisa Cassia, a registered nurse, a certified clinical transplant coordinator, and a senior registry research coordinator for the Transplant Pregnancy Registry International in Philadelphia, Pennsylvania. Welcome, Lisa.
Thanks so much for having me, Steve. This is a very important topic, and I'm hoping we can educate our fellow healthcare professionals about this registry.
Here is our learning objective for today's program. After participating in this activity, learners should be able to monitor patients and report pregnancies to the mycophenolate pregnancy registry. All right, I've got a lot of great questions for Lisa, so let's get started. So first off, why a registry?
Well, I think it's really important that we collect these outcomes. It's only by collecting these outcomes that we know that there's risks involved with this medication. And it's really important for providers, patients, and other healthcare professionals to realize that they need to educate patients about the risks. And we really need to know if they're continuing to have exposures as well, because patients are supposed to be on effective birth control when they're prescribed mycophenolate. So our ultimate goal is to have no exposures to pregnancy with mycophenolate.
Lisa, what are the reporting requirements?
So anyone who has a pregnancy while on mycophenolate should be reporting to the REMS pregnancy registry. And there's multiple ways that they can do that. Online, they can call the toll-free number. And it's really important, like I said, to kind of do that pre-education with patients so they know that there's a risk and they should be taking effective birth control when they're prescribed the mycophenolate at the onset. So we can hopefully in the future prevent any exposures, because I think the whole goal for the mitigation is that there are no exposures, even though we're still seeing unplanned pregnancies with patients while taking mycophenolate. And it's not just transplant patients either. It's those patients who are taking this medication for other autoimmune disorders. So it's not just directed at transplant patients, but anyone who's prescribed a mycophenolate for a variety of conditions.
Now, how do you screen and monitor patients for pregnancy?
Well, what you need to do is do a pregnancy test, especially in young women of childbearing age. When they come into clinic, if they're saying they're sexually active and maybe not taking birth control, they really should have a pregnancy test when they're coming into clinic. And if there's any problems, going forward, if they're missing their menstrual cycle, or a lot of times with our patients, they're very irregular. So it might be good just to do a pregnancy test every time they come in. And it's very important, once again, to follow up while they're in clinic with that information about effective birth control and really talking about using the birth control properly, because they really should be on 2 forms of birth control if they're on the mycophenolate effective, unless they have an IUD or have had permanent sterilization.
Now, what is the role of the nurse and non-clinical administrators of the program?
So I think they're there to support the physicians and pharmacists that are prescribing this medication. I think if we all know that transplant is a multidisciplinary field and we're all working together. So the coordinator or nurse might be the first person to hear that there's a positive pregnancy test, a home pregnancy test. And I think then it needs to be followed up with a blood test in our patients, and then letting the patient and the physician know about the registry and that they need to call and report that pregnancy exposure when it happens. And I think, they do follow up throughout the pregnancy and post-delivery too. So it's really important to get that all-encompassing information, because we really want to hear how the babies do long-term also.
Lisa, do you have any tips or pearls for optimizing patient communications?
I think if patients have access to email and you have email for them and they're tech savvy, I think sending them links to this registry would be key. And if there is any way that anything can be put in any other kind of social media, because I've found that reaching patients, that's the easiest way to reach them nowadays, is trying to use some kind of technological advances that we have. If a reminder can be put in their Epic note about, hey, they might have had this exposure, let's send them the information for the pregnancy registry, and let's follow up with them at their next visit to make sure that they registered. Or if you have a computer in the room, you could ask them to register right while you're there with them, and then do, your piece of the enrolling the patient as well, right at the same time. And then, if you have that time, you can get it all done at once and then just do the follow-up as it goes.
Now, how is participation and compliance with the registry to date?
I think that it's not very good. I mean, I know even from my other registry that I run, it's voluntary, and we know that there's minimal participation. I think healthcare professionals think it's going to take a lot of their time and that they don't have the time to put into it, or they'll tell patients about it, but they won't follow up to see if the patient actually registered. And I think that's where we really need to have more compliance with this type of registry and all registries, because it's really important. And that's how we found out that mycophenolate did have embryo toxicity, is because we had outcomes from without the mycophenolate, and we were able to compare them to the outcomes with mycophenolate exposure. And if we hadn't have had that, we wouldn't even maybe have figured out that there was a problem with this medication. So it's really important to participate in all pregnancy registries.
I think that's a good segue to a different question, Lisa. Who is the person on the healthcare side that should be responsible for reporting a pregnancy to the pregnancy registry? Is it always physicians? Is it the nurse? Is it the pharmacist? Can it be any of us on the transplant side or rheumatology side that's working with these patients?
I think it's all the above. Like we talked about, transplant is a multidisciplinary field. And I think if it's in the notes or if it's at clinic, we say, hey, are you going to do this? If not, or maybe you can communicate back and forth. Oh, I already had this patient enroll. Let's follow up. Can you help me with the follow-up? Because we know that a follow-up's coming in a couple of weeks and the patient's coming back to clinic. So let's put that note in again with the reminder to please follow up, we know that next question's coming for the pregnancy registry. So let's make sure we get that information to them. And it really is going to help all of us, because we really want to know what's happening out there. But once again, like I said, I think the more important piece is that the patients get the education ahead of time so we don't have these exposures. I think that's where we really need to focus more on, because we'd rather not have any exposures to pregnancy with mycophenolate, because we know that at least 25% or more are going to have some type of birth defect, and almost 50% of the pregnancies are going to end in a miscarriage if they have exposure. So it's really important, especially because a lot of our patients who are childbearing age do want to have a pregnancy. So we want to make sure they do it in a planned setting, because that's going to be best for everybody. And then we can, not have these exposures anymore to mycophenolate during pregnancy.
Great. What are some of the key findings from the registry?
So I have not personally seen any from the REMS registry, but I know from the transplant pregnancy registry, like I said, almost 50% of these pregnancies end in a miscarriage if there is a first trimester exposure to mycophenolate. And we've seen it between 18 and 25% with birth defects. And there's a specific pattern of birth defects. We see a condition called microtia, which is a malformed or misshapen ear. And then also there can be no internal auditory canal. So the offspring can actually be deaf and need cochlear implants. Cleft lip and cleft palate, some heart malformations. So really some severe birth defects that are seen with exposure to mycophenolate. We haven't seen as many reports recently. And like I said, it's not just in transplant patients too, but we've seen this in patients who've taken mycophenolate for lupus and other autoimmune diseases without the calcineurin inhibitors and other medications that we give our transplant patients. So it has been seen with just single mycophenolate exposure as well.
As a practitioner, I do think it's important to note that you guys are available to help folks even outside of mycophenolate. I know you and I have interacted. You helped me with a clinical quandary where I had a patient on belatacept that got pregnant. So I think you guys are an excellent resource for transplant practitioners or folks using immunologic medications even outside mycophenolate. So I think that's super important for everyone in the audience to understand.
Thank you. Yeah, we're always here to help, whether it's a mycophenolate or any immunosuppressive issue. We really try and, collect all those outcomes and disseminate it to the transplant healthcare professionals too, and patients.
So we know that everyone in the transplant team or the prescribers team that is prescribing mycophenolate has a role in terms of the mycophenolate REMS, the registry. What information is collected? Can you describe some of the resources available at the mycophenolate REMS website that may help us as practitioners aid at preventing the need to report these pregnancies to the registry?
Yeah, so there's some great resources on the website for patient information. There's a few brochures that you can download right off of the REMS website. And I think they're very helpful to give to patients while you're sitting in clinic and really reminding them, and maybe even give them to them again at a follow-up visit. I don't think you can ever give patients the information too many times because it's really important. And also, I think, especially if it's their first clinic visit after their transplant, I have a feeling that they're going to be very overwhelmed and they're going to be getting a lot of information and they might not absorb that specific information about one medication because they're kind of trying to figure out their whole new role now after transplant. So I think it's really important that they're given it not only at clinic, but in the hospital before they leave too. And it's really important for everybody to have that birth control conversation with patients, to let them know that this can and does happen and they can become pregnant after transplant. I can't tell you how many times people have told me, oh, I was told I never could get pregnant. And yes, maybe while on dialysis or maybe when you have liver disease, but with a successful post-transplant, we know it can happen fairly easily. I think it's important to just let patients know that there is the website available and that they can download the information. There's a whole, area available for patients and there to get information. It's not just for the healthcare providers. So I really think it's a comprehensive website that anyone can find, I think, information about mycophenolate and trying to mitigate exposures during pregnancy. So really, some of the prescribers' role for the mycophenolate pregnancy registry is to really instruct the patients to tell you if they get pregnant anytime during treatment or within 6 weeks following the discontinuation of treatment. So that's important too. Even if they're off of it for even a couple weeks, if there's an exposure, they still want to hear about that, and to report pregnancies to the Mycophenolate Pregnancy Registry. Like I said previously, encouraging patients to participate in the registry and read all of the information available on the website. And as the healthcare provider, you need to provide your contact information so that they can be called regarding the follow-up, because it really is some of the follow-up that's really important to let the registry know about. And that participants in the registry, they do agree to provide their information about their pregnancy, including information about prenatal drug exposure, and their demographic information as well. And also there is a consent process for patients also, and they're really encouraged to participate as soon as they know that their pregnancy occurs. I know that that can be important because there is a little bit of a difference between a prospective outcome and retrospective, whether you know the outcome already or not. There's also some more information that we want to let you know about that's collected, and it's for newly reported pregnancies or ongoing pregnancies. There's some baseline questions in the first, second, and third trimesters and at the time of delivery. And then for infants, they like to follow up at 2, 6, and 12 months. The demographics, the mycophenolate exposure, including the dose and timing, maternal and fetal outcomes. So we want to see how the patient does in their transplant, because when you think about pregnancy after transplant, it's not just the fetus, but it's the mother and the transplant as well. And then a root cause analysis, what led to the exposure, and then how often the patient was counseled. So kind of going back to that, each clinic visit, they should be reminded that they need to be on birth control and that pregnancy can happen. It's not just a one-time counseling for patients. And also, once the pregnancy is completed, as much information about the outcome as possible. And sometimes I know with the transplant pregnancy registry, we like to get records on the baby as well, especially if there was a malformation seen. So just kind of an overview of what the website looks like. This is the prescribers portion. There's, if you can see up top on the across the board, it has prescriber overview, patient overview, and other healthcare professionals overview. There's a whole section for materials, how to report a pregnancy, additional resources, frequently asked questions. And then there's even on the website more CME activities. So there's a lot of information on the website for prescribers. And then if you look, you can see the patient overview. Do I need to use birth control? Some kind of frequently asked questions. I take mycophenolate, what do I need to know and do? So this is where you really can start with that education for the patient. And then for other healthcare providers, there's a whole list of things that you need to do for the mycophenolate REMS. So just, I think becoming familiar with this is really important, because then the more, it's just like everything, the more you do it, the easier it becomes. And then there's just a little bit more here about how to report a pregnancy and what goes into it. And there's really 2 ways to report. You can do it by phone or online. So it's really, there's, you know, if you just want to do it completely by filling out a form on the computer, easy enough. Go right to the website and complete what's needed. And you can look over again, you know, all the different requirements that the registry does need. And then, like I mentioned earlier, there are other resources, patient and healthcare professional brochures and guides. So you can give them to your patients right when they're coming into clinic. If you know you have 10 people, 10 women of childbearing potential on mycophenolate coming to clinic, you could print out 10 and just have them available to give to the patients. So they really try and make it kind of as self-explanatory as possible and easy to navigate.
All right. I'd like to thank you, Lisa, for joining me this afternoon. This was a very important conversation, and I do hope we can get more patients to enroll. But like you said, I really hope we can provide practitioners with enough education that we can prevent enrollment by preventing these pregnancies.
I agree 100%, Steve, that our whole goal is to not have pregnancy exposures with mycophenolate. However, we know that unplanned pregnancies still happen and happen frequently. So it's really important to get those outcomes reported to the registry so we know what's happening and how we can use that information in the future to help other patients. Because I think that's the real goal, is we want our patients to have the best quality of life. And if a pregnancy is in their future, to make it safe as possible as well.
Excellent. Now, to summarize, I'd like to offer a few SMART goals to our audience, which are specific, measurable, attainable, relevant, and timely. Visit mycophenolate-REMS.com for comprehensive information and resources about the mycophenolate REMS program. Describe the program to patients who qualify, and report to the mycophenolate pregnancy registry any pregnancies that occur during mycophenolate treatment or within 6 weeks following discontinuation of treatment. And as Lisa mentioned, you can reach them by phone, 1-800-617-8191, or you can fill out all the information online. As I mentioned, this is the third of 3 CMEO snacks on the mycophenolate REMS. Please visit the virtual education hub at www.cmeoutfitters.com to participate in parts 1 and 2. And don't forget to complete the evaluation to claim credit for today's activity. Thank you for your attention, and we hope you will find the information useful in caring for your own patients.